Hello friends, I am Dr. Abhinav Gupta, Managing Director of Makino International Healthcare Private Limited. We have chain of physiotherapy and rehabilitation centers in hospitals and clinics. Today we are going to discuss about osteoarthritis. This is the most common condition that you encounter in your clinics as well in theory part. Now what is osteoarthritis? Osteoarthritis, commonly known as wear and tear of joint and the cartilage. It is the commonest kind of arthritis. Basically, what occurs due to degeneration, wear and tear of the cartilage, the rubbing of the bone and the joints against each other occurs, and occurs due to the less shock absorption. The rubbing results in pain, swelling, stiffness, decreased ability to move, and the formation of bone spurs can also be there. If we talk about the prevalence of osteoarthritis, osteoarthritis is most common kind of arthritis. It basically occurring in young age as well as in old age. The chance of developing osteoarthritis rises with rising age. Earlier, it was considered that getting osteoarthritis is common of beyond the age of 45 to 50 years. But now, the census has got changed and we are considering the age of 40 years to get osteoarthritis. According to the Arthritis Foundation, if we take the data from United States, 27 million of the patients are having osteoarthritis. Women are more affected than men. If we talk about the common causes of osteoarthritis, the common causes includes age. The ability of the cartilage to heal actually decreases with increasing age. Another is overweight people who are overweight or obese. With increasing weight, there is increased pressure on all joints, which especially on knees. With every pound increase in weight, there is 3 to 4 pound increase in the pressure on the knees. Another cause is hereditary cost, that we should go check for whether the patient's parents or the grandparents can be osteoarthritic. Then gender, as I have told you, women are more likely to get osteoarthritis as compared to the men. Then there are repetitive stress injuries are also one of the commonest cause of osteoarthritis. This kind of injuries includes heavy weightlifting, occupation like kneeling, prolonged squatting, or contact sports, or kind of constant pressure on the knee joints. Then another cause that can occur in athletics. Athletics, if we talk about, we all are aware that they are very active people. Then you must be thinking why they are getting affected by osteoarthritis. Basically, athletes with improper biomechanics or inappropriate posture tend to have wear and tear phenomena. Athletes involved in soccer, tennis, or long distance running might be at higher risk of developing osteoarthritis. That means athletes should take precautions to avoid injuries. They must follow the appropriate biomechanics. They should take care of their muscle strength. Other illnesses can also cause osteoarthritis to occur, like rheumatoid arthritis or any other arthritis, such as iron overload or excessive growth hormones can also lead to osteoarthritis. Then coming up to the signs and symptoms of osteoarthritis, if we talk about commonest sign and symptom, that is pain and the stiffness, which leads to the decrease in range of motion of the knee joint. Pain that increases when you are active, when the patient is at most active stage and gets a little better with rest. There will be swelling, there will be feeling of warmth around the joint. Stiffness will be there, decrease in mobility of the knee joint, making it very difficult to get in and out of the car, stairs, or stair climbing. Then there will be a cracking sound that is known as crepitus. Now, These are the signs and symptoms that we have discussed. There you can also find the tenderness over the medial joint line, as the line of gravity passes through the medial knee joint, so there is more wear and tear at this site. Now, if we talk about the diagnosis, the diagnosis as such, there is no special test we consider for the osteoarthritis, but we can rule out other conditions to diagnose osteoarthritis. First of all, thorough examination and assessment is very important. The diagnosis of osteoarthritis will begin with the physical examination. Medical history taking is very important. Then we go for range of motion of the knee joint, VAS score for pain. Then muscle strength should be measured. Other radiological imaging we can go for is X-rays. In X-rays we can found the bone damage, we can see bone spurs, osteophytes can be seen. Then MRI scans can be done if the image is not clear on the X-ray. MRI scan can also rule out other conditions like other immunological disease or the rheumatoid arthritis, which can be causing the osteoarthritis. Now, coming up to the management of osteoarthritis, management is further divided into three parts: medical management, surgical management, and the physiotherapy management. Medical and physiotherapy comes under the conservative treatment, and if the patient is not getting relieved with the conservative treatment, then we can refer the patient to the surgical management. The primary goal of treating osteoarthritis of the knee are to relieve the pain and return of the range of motion of the knee joint. The treatment plan will typically include a combination of multiple drugs as well as the physiotherapy treatment. First and foremost important is weight loss, because as I have told you, every single pound is adding 3 to 4 pound of pressure on your knee joints. Now, losing even a small amount of weight can significantly decrease the amount of wear and tear in your knees. Another component is exercise is very important, as we have to strengthen the associated structures near the joint so that there will be less loading on the knee joint. Stretching of the muscles like calf muscle is very important to prevent conditions like extensor leg. If we basically talk about the medical part, that what medicines can be used, we can go for NSAIDs like acetaminophen or ibuprofen, or we can use painkillers like naproxen. Other than that, coming to the physiotherapy treatment, we talk about, we can use TENS, ultrasound, IFT, laser, multiple electrotherapy modalities are there, but that will depend on the symptoms and requirement of the patient. In manual therapy, what we can do is AP glides, PA glides, manual distraction can be given to increase the blood flow to the joint and to improve the healing process. Some of the patient, adding some exercises to the department of physiotherapy, what we can go for is isometric training of the quads, hams, VMOs, and now a recent studies suggest that proximal stability is very important, as we consider as human body is a one segment, one unit. So proximal stability is very important. We should go for hip strengthening exercises along with the knee strengthening exercises. Other treatments that we can go that people prefer is corticosteroid injections, injection of hydrocortisone, injection of use of multiple steroids, alternate therapy they go for like acupuncture, taking supplements, but we are not having as significant results or researches to support the treatment. Use of braces or the knee brace are recommended to patients just to offload the joint. Till we are working on the muscle strengthening part of the joint, we can go for use of braces and other things to make the patient more comfortable while walking and stair climbing. Now, if we talk about the surgical management of osteoarthritis, there are multiple surgeries available, but will be done as per the requirement and the condition of the patient. And it will only be indicated in case where conservative treatment has no further benefit for the patient. First surgery is our arthroscopic surgery that uses a small telescope and kind of small instrument, we can say. The surgery is performed through the small incision and the surgeon uses the arthroscope to see your joint space. Once the surgeon reaches the joint space, it can remove the damaged cartilage, and the procedure is often used basically for the younger patients which are below the age of 55 years. Now another surgery, if we talk about, the most common surgery is osteotomy. Basically this is the procedure in which proper alignment of the knee joint are done. Nowadays an osteotomy is not considered as a part of a permanent treatment and further surgery may be needed in later stages. The most commonest kind of surgeries nowadays we are hearing is TKRs, that is total knee replacement. Total knee replacement or total knee arthroplasty is a surgical procedure in which the joint, existing damaged joint, is replaced with the artificial parts of the metal and the plastics. This replacement could include the unilateral or as the bilateral side depending on the affected sites. The surgery may need to be repeated if the wear and tear is still not restricted to the patient, because these elements like metal elements, plastic elements also have a lifespan, whether it is for 12 years, 10 years or 5 years depending on the activity level of the patients. But the results are generally very good and the patient gets immediate relief from the symptoms. Physical therapy or physiotherapy is as important as in the conservative management is in the surgical management as well, because post surgery the physical therapy management is very, very important to regain the range of motion, again to subside the pain related to the surgery and to prevent the chest complications associated with the knee surgery or any of the surgery. The modalities that can be used post surgery to regain range of motion, to regain pain free range of motion, we can use CPM machine, we can use TENS, ultrasound, IFT. Manual mobilization is very, very important after the surgery. Other than this, the alignment and the joint, the alignment of the joint and success rate of the surgery mostly depends on the surgeon as well as how appropriately he is aligning the joint. Nowadays, the alignment errors have been decreased up to the 99% of the extent because of the use of robotics and latest technology. Thank you. If anyone have any query, suggestion or feedback regarding the video or any suggestion for a new topic for us to make video, you can contact us at healthcaremakino@gmail.com and share and subscribe our channel on YouTube, that is Makino Care. Thank you.